sprains are probably one of the more common reasons people seek medical care in this country. An ankle sprain happens when you're running or walking and your foot inverts or rolls. That's the most common reason, which means you're doing this. And what happens is this ligament here, the anterior talofibular ligament, typically will stretch if not tear. That tears first, followed by the calcaneofibular ligament, followed by the posterior talofibular ligament. And they tear in a predictable fashion, and we can sort of gauge the intensity of the injury based on what we find in clinical exam. The number one treatment for ankle sprains should be bracing or immobilization short term, and then physical therapy. Studies have shown that people that get into physical therapy early and quickly with an ankle sprain have the best outcomes. So for instance, 6 months to 12 months later, they have less instability, less pain, and less swelling, and a more functional or normal ankle. People that try to self-treat it or sort of just walk it off are the ones that will have functional problems later. Interestingly, most ankle arthritis later in life is because of neglected sprains early on in life. Just one little subtle bit of instability in the ankle can lead to complete breakdown of the ankle over time. It's very, very important if you have an ankle sprain to get it treated early and treated well. Seek out a competent physical therapy. You need to have the appropriate bracing. And then in rare cases, but it does happen, we actually have to go in and surgically repair the ligament or reconstruct it. And there's a variety of different ways to do that, from tendon transfers to simple direct repairs to using what's called an internal brace, which is sort of a fiber tape embedded in a suture anchor that gives extra stability. And that depends on the activity level and the age of the patient. So we would ask that you seek treatment early and quickly for ankle sprains. Obviously, we offer a variety of treatments for them, but it's best if you don't just try to self-treat it with a bag of ice.